These types of mass shootings are disturbing because they happen without warning and in the most routine of places.
But dealing with such tragedy goes beyond the survivors and their families. It impacts even those who are just hearing about it. KITV4's Diane talked to a mental health professional about dealing with psychological trauma.
A day after a U.S. sailor opened fire at Pearl Harbor, victims and survivors now begin the difficult journey of healing.
The first year is the most difficult.
Therapist Jamie Fujimoto says there is no timeline for grief, and the tragedy has affected hundreds or thousands more in the community.
Pearl Harbor right behind me, literally in our backyard. Mental health professionals say they are concerned Wednesday's shooting hits close to home and will have an impact on our broader community.
Fujimoto describes a client who was on base at the time and came in hours later to talk about how the shooting triggered his PTSD.
Definitely a lot of anxiety, trauma, depression.
Others, she says, may still be in shock. It may take a while to recognize their feelings. Here's what to look for.
If they are feeling unusually higher levels of anxiety, higher levels of depression, not wanting to go to work, unable to function normally, and talking to friends or family doesn't work, then they can seek therapy.
Fujimoto points out some people may feel shaken because it happened close to home.
That's really scary for a lot of people. So then people tend to wonder, are we safe?
After she heard the news,
that triggered a little bit of me feeling unsafe as well. I ended up locking my door, and then I thought, wow, that's really interesting that I did that.
Her advice is to pay attention to your feelings, ask for help, and be patient.
To talk out your feelings. People, whether you know the victims, whether you were directly affected by the incident or not, definitely in any way that you were affected, people have feelings about what happened.
Diane, KITV4.